Good afternoon, Ma. Thanks for joining. Today we'll be talking about tonsillectomy and tonsillitis. You're the only one watching at the moment, so I'm just gonna wait for a few more people to join and then we can make a start. So please bear with me, Ma. We've got two people here at the moment. Should we just wait for a few more minutes and then we can start? Because I feel like if I start now and then we have other people joining in, I might be forced to go back on the things I've already said. I don't mind going back, and then for the fact that I haven't really got much time to spend today because I've got things I need to attend to ASAP. So I just thought I'll come here today and talk about it, for a few minutes, maybe 15 minutes or 20 minutes maximum. Okay, I think we should just start because time is going. I haven't got much time today. So, good afternoon, guys. I'm here again today. Apologies for not having this tonsillectomy video a while ago. I think I posted the slides about 2 weeks ago. So, I've been kind of busy, being a mom and working as well. It's really taking a lot of my time. So, I'm just going to make a start. We're talking about tonsillectomy, but before, tonsillectomy is the removal of the tonsils, and tonsils are the two glands that are situated at the back of our throat, on both sides, both the left and the right side of our throat at the back. That's what tonsils are. So tonsillectomy is the removal of the tonsils. Tonsillectomy is a surgery in order to remove the tonsils. But tonsillectomy, we tend to do tonsillectomy for children following tonsillitis. And tonsillitis is the swelling of the tonsils, which, like what I've just said now, that the tonsils are located at the back of our throats. So tonsillectomy is the infection of the tonsillitis is the infection of the tonsils, which is, is a swelling of the tonsils, which is due to infection in the throat. Tonsils are the two glands. Tonsils are the two glands at the back of our throat, on both left and right side. Tonsillitis is the swelling or inflammation of the tonsils due to infection. Tonsillitis is common in children. A lot of children have tonsillitis. And tonsillitis do happen to children between the age of 10 or under, but then it can happen to older children or adults as well. Tonsillitis can be treated with antibiotics, with course of antibiotics. Oral antibiotics can treat tonsillitis, but if it's not being treated, if the patient still have symptoms of swelling of the tonsils, pain, vomiting, unable to keep food down, then they can go to the hospital for admission. Then they give them IV antibiotics. But then another treatment, if the oral antibiotics, as in antibiotics that we take through our mouth, is not working, they go to the hospital, we give them antibiotics, and then we perform the surgery on them, which is called tonsillectomy, to remove the tonsils if the pain is unbearable and the antibiotics is not working, or if the child has recurring tonsillitis, then they tend to remove the tonsils. So I'll recap. Tonsils are the two glands situated at the back of our throat. Tonsillitis is the swelling or inflammation of the tonsils due to infection. So we treat the tonsillitis with oral antibiotics first, and if the oral antibiotics is not working, then we go for the patient comes to the hospital. Initially, they tend to go to the GP, to the community doctors, because here in the UK we have community doctors that assist patients in the community. So if the patient is not getting better, then they tend to take them to the hospital. The community doctor can refer the child to the hospital to get seen by the doctor in A&E, accident and emergency, and then they take it further from there. So if the GP, the community doctor, has attempted to treat the child with oral antibiotics and is not working, or the patient or the child keep having tonsillitis every now and then we perform the surgery on them, which is called tonsillectomy. Tonsillectomy is the removal of the tonsils. Tonsils are the two glands. The other day when we had our sickle cell live chat, I was trying to talk about what our next topic was going to be, and I forgot my words. I was trying to talk about tonsils, tonsillitis, and I forgot what the definition of tonsils are. I was like, the two things at the back of our throat, but I had a busy day that day. I finished the night shift and I didn't sleep. Like today now, I finished the night shift this morning and I've not slept at all. And I'm going back to work tomorrow morning. So, being busy, having to work a night shift, coming back and not being able to sleep, and then I've got things to attend to in the house as well, can make you forget your words. So I forgot my work that day. And what I was trying to remember was glands. One of my sisters on the video said the two droppings at the back of her throat. Yes, but then I was trying to remember the actual word, which is glands. So they get infected. The patients get treated by the community doctors. If he's not getting better or the patient keep having recurring tonsillitis, then they take them to the hospital and then we perform the surgery. The doctors perform surgery on them, which is just the removal of the tonsils in order to stop the child from having tonsillitis in future. What are the symptoms of tonsillitis? Pain in the throat, difficulty swallowing. The child won't be able to eat or drink anything, even if you're trying to give the child medication. For example, a boy, if you're trying to give the boy medication, he won't be able to swallow it because he's got swollen glands, he's got swollen tonsils, and that hurts. When I posted the slides 2 weeks ago, a friend of mine said she had her tonsils taken out when she was in high school and it hurts very bad. That was what she said. Yes, tonsils can be very painful. I mean, very painful. So the child won't be able to eat or drink, won't be able to take any medication. Redness to the throat. If the child opens his mouth, if he opens his mouth, you see redness at the back of the throat where the tonsils are. They will be inflamed, look red, inflamed and swollen neck as well. Then it tends to get more obvious on the neck. The neck side get really swollen all around under the jaw, all around the neck as well get swollen. That's also part of the symptoms of tonsillitis. Fever as well. High temperature is fever. Patients with tonsillitis do have fever, as well as headache and feeling tired and cough. All those symptoms are noticeable in tonsillitis. You can't miss it. Most especially the redness in the throat, the difficulty in swallowing water, food, medication, headache, temperature, temperature is fever, swollen neck and all that. So what is tonsillectomy? Tonsillectomy is the removal of the tonsils. The tonsils are there to help the children fight germs when they're quite young. But then after the age of about 3 to 5, the tonsils doesn't really work anymore. So it's just there. The work of the tonsils in order to fight infection get reduced. So it's just there. It's not really useful anymore. It's just there because it's more useful when the child is below the age of 4 and 3. That is when it fights infection. But as the children grows, it doesn't do any work anymore. So it's not going to do the body any harm by taking it out. But the body can still fight infection in another way. And our body fights infection every now and then anyway. So because the tonsils is not really doing any more work there, then the doctors do recommend taking the tonsils out. It's better to take something that is bothering you out than leaving it there and then causing more harm and pain and affecting your normal day-to-day activity. And why does a child need tonsillectomy? The main reason for removal of tonsillectomy is to stop recurrent tonsillitis or to improve the problems of breathing. Children do have breathing problems. Some kids have sleep apnea, which is not being able to sleep, having problem when they're sleeping. They won't be able to breathe properly actually when they're sleeping at night. And by so doing, the amount of oxygen in their body tends to drop. When a child has sleep apnea, they won't be able to sleep well. When they have sleep apnea, the amount of oxygen that circulates into the body reduces, and then that obstructs their sleeping. So that's another reason why they take out the tonsils, why they do the tonsillectomy surgery. And removing tonsils from a child help them, stops the tonsils from getting swollen over and over again. But they can still have sore throats. Even after having removal of tonsils, the child or the adult can still have sore throats. Removal of tonsil doesn't automatically stop you from having sore throat, but it just stops you from having tonsillitis. Tonsillitis is the swelling. Tonsillitis is the swelling of the tonsils. I'll come back to your question, sis. What's the effect on the uvula? Uvula, what do you mean by that? So, before the operation, the child will be seen and assessed by the doctors to know if he's suitable to have tonsillectomy, to have the removal of the tonsils. It will be assessed. They'll come into the hospital, and sometimes it's always an emergency situation, like there and then when the child presents with the pain, swelling of the neck, inflammation of the tonsils, they assess them there and then to know what needs to be done. But the child will need to be off school for about 2 to 3 weeks just to get better, and in order to avoid the child from having infection. You need to have paracetamol and ibuprofen ready as pain relief to help with the pain, to stop the pain or to control the pain if the child already has the pain. And the doctor will also explain what's going to happen, what to expect during the surgery and after the surgery, and after the surgery care for the child. And the procedure is just done by putting the child to sleep under general anesthetics, and then they can remove the tonsils. Sometimes they shrink them. They do cut them out, and sometimes they shrink them. They shrink them in order to get swollen, to get smaller in size. And then after the surgery, the child will be taken to recovery units where they recover and then get transferred back to the ward. And the child is expected to have sore throat after the surgery, but then the doctors will prescribe some pain relief to have regularly. He is also expected to have sore ears as well as sore throat, because the throat, ears and nose are all joined together. They all have the same nerves that works around them. So, and then when a child is presented with earache following a tonsillectomy, doesn't mean there is an ear infection, no, but it's just because it's one whole nerve that connects the whole ear, nose and throat together. And care of the patient after tonsillectomy: administration of antibiotics for risk of infection, regular painkillers like every 6 to 8 hours. Encourage the child to eat and drink because it helps in the healing process. You can start by giving them water, toast like raw food, just to soothe or yogurt to soothe the throat, and biscuits, and then gradually you can go back into the child's normal routine. And if there is vomit, if the vomit is clear, fine. It's normal for a child to vomit following any surgery, any procedure anyway, not necessarily just tonsillectomy. It's normal to vomit because of the anesthesia that's been in the body when they put the patient to sleep. So vomit is fine, but just try and give the child fluids. And another thing to look out for in tonsillectomy, post-tonsillectomy, is bleeding. Bleeding can be very dangerous. It is a very serious thing that needs to be sorted out ASAP. If you have a child if your child has tonsillectomy and he or she is bleeding from the mouth or the nose, she needs to get seen ASAP by the doctor. But these tend to happen when they're still in the hospital. On Wednesday nights, I had a patient, a 5-year-old, that had removal of tonsils, that had tonsillectomy, and he bled about 2 o'clock in the middle of the night. And this boy was post-op. He came back from theater sometime in the afternoon, around 3 o'clock. He didn't bleed before then. He ate and drank. He had pain relief and all that. But then they just thought, we'll keep him in the hospital overnight just to keep an eye on him. And about 2 o'clock in the morning, he had a vomit. He had a vomit. The mom called me to check up on him, and I realized that he had a blood vomit. But that wasn't it. That wasn't about it. I had to do his observation to make sure he was okay. But then while checking him up, I had to get a tongue depressor, like a stick we used to depress the tongue down so we can see the back of the throat. And this boy had blood clots in his mouth, at the right side of his mouth. Like, blood clots is when your blood is stick together, like thick blood stick together, and that is not good. That is not a good sign following any kind of surgical procedure. So I had to get the doctor to come and assess this child because, following a surgery, he's bleeding and he's got blood clots. So the doctor came to the ward and saw him and prescribed a medication for him, which is called tranexamic acid. Tranexamic acid is a medication that stops bleeding following any kind of infection, following any kind of surgery. It can be given to are you following me, guys? Please let me know if I need to go back or repeat what I've said in the past. And I'm still going to come to the question. What was I saying? Yes, so the doctor prescribed this patient, this 5-year-old boy that had tonsillectomy, bleed, some tranexamic acid. Tranexamic acid is a medication that stops bleeding following any kind of surgery or period, menstruation in women as well. If we have a woman that has been bleeding for so long, they can give the patient tranexamic acid in order to stop the bleeding. And it forms cloth to stop, thank you. It forms blood to stop it basically forms a blood clot. in order to stop fresh blood from coming. So we gave this patient, this boy, an infusion into his vein, and it got better. But then they had to take him back to surgery again the following morning. So it was post-op. He had his surgery on Wednesday afternoon. He had the bleed about 2 o'clock in the morning, as in 2 o'clock in the morning on Thursday. So he had the tranexamic acid and the fluids. We had to keep him new by mouth, as in not eating and drinking anymore, because if a child has bleed following surgery, they tend to take them back to the hospital following tonsillectomy or adenoids. They tend to take them back to the theaters to see what's wrong and stop the bleeding. So he had to go back. So we told him to stop eating and drinking then. He was sleeping anyway, just woke up and coughed, and then he had a vomit at 2 o'clock in the morning. So he went back to theaters yesterday, and he had correction of his tonsillectomy, and then it got better. So straight after he got back from recovery, he was able to eat and drink. But then he still stayed in the hospital overnight last night. So he's probably going to be discharged at some point today if he's okay. So that is what happened. There are risks of infection. Excuse me, please, guys, just 1 minute. I need to attend to this ASAP. I'm so sorry. Yes, so he had to go back to surgery to correct his tonsillectomy, and then he stopped bleeding. Bleeding is a very serious thing that needs to be looked into following any kind of procedure. It is normal. It is common in children that has tonsillectomy, adenoidectomy, or grommets. They expect that to happen, which is why sometimes they tend to keep an eye on them. But then it can happen after the patient has been discharged as well. It does happen. What we advise parents is to keep an eye on the child, give them regular pain relief, and make sure they eat and drink as normal. And they shouldn't take part in any form of sport activities or exercise at all for 4 weeks, 2 to 4 weeks after the surgery, in order to stop the risk of being infected again, and in order to stop the risk of bleeding as well. So he went back to theaters and it got better, which is what we always advise, to keep an eye. If the child has, yes, that's what I was going to say, if the child has bleed following the surgery, take the child to the nearest hospital to get checked ASAP without wasting any time at all. And if it's not even a bleeding case, if it's a case of pain, that paracetamol and ibuprofen, regular analgesia or painkiller, is not being able to control, we do advise parents to take them back to the hospital straight away to get checked. We shouldn't play with pain in tonsillectomy and bleeding in tonsillectomy. I think that's about it. So there isn't really a lot of things to say about tonsillectomy, apart from, tonsils are the 2 glands that are located at the back of our throat. Tonsillitis is the swelling or inflammation of the tonsils. The tonsils that are the glands located at the back of our throat. And then tonsillectomy is the removal of the tonsils in order to stop recurrent infection. In order to stop recurrent infection, we do tonsillectomy. And tonsillectomy is an easy and straightforward procedure, but then we need to watch out for bleed and severe pain following the surgery. So sorry about the noise in the background. So let me go to the question I have. Please let me know if you have any questions. Someone says, what is the effect on the uvula? It doesn't have any effect on it at all. It does not have any effect on it at all. Tonsils is different. Tonsils are different from the uvula. And uvula is the drop-in, the gland that is located at the back of our throat. The one that's just hanging, coming from the top of our mouth. That is what uvula is. It does tonsillectomy. doesn't have any effect on it. Have I answered your question? So that's about it. We don't have much to talk about on that. I'll give you maybe 2 to 3 minutes to see if we've got any questions to treat before I go. Thank you so much, guys, for coming in all the time. I really do appreciate you. You guys give me the strength and the energy and the zeal to keep going, to keep doing this every now and then. I'm always looking forward to coming here to talk to you guys, to talk with you, not to talk to you, because we need to interact. We need to talk to each other. Thank you so much. You give me the strength to be able to do this, even when I feel like I don't have the strength to, but you keep me going. More health teachings for parents after the operation. Advice for parents after tonsillectomy: give your child regular pain relief, paracetamol every 4 to 6 hours, ibuprofen, which is also called Nurofen, every 6 to 8 hours. Paracetamol, you can space them out. For example, if you give paracetamol to your child at 12 o'clock midday, 12 o'clock in the afternoon, I would advise it can last up to it can last up to 4 to 6 hours. So we do go for 6 hours in the hospital. So you can give another dose of paracetamol at 6 p.m. after giving the first dose at 12, for example. So, but then if you want to give ibuprofen, I would advise you give ibuprofen in the middle. So you give ibuprofen at 3 o'clock in the afternoon. That is 3 hours before the first dose of the paracetamol. And then that's going to be another 3 hours before the second dose of the paracetamol. 6 hours paracetamol. You give it at 12, it's due next at 6. Then give ibuprofen at 3 hours before. You still have the paracetamol in the system. And then that is 3 hours after the first dose and 3 hours before the second dose. And then when you give ibuprofen at 3 o'clock, is a 6 to 8 hours. We give it every 8 hours in the hospital. You give another ibuprofen at 8. No, after 8 hours. But then, you had already given paracetamol at 6 o'clock. And then 3 o'clock to 6 o'clock is 3 hours in between the paracetamol. And then, 3, 4, 5, 6, 7, 8, 9, 10, 11. So if you give ibuprofen at 3 o'clock in the afternoon, then you can give another dose of ibuprofen at 11 o'clock p.m., 11 at night. That is after 8 hours. So, and then you had already given another dose of paracetamol at 6 o'clock. Then the next dose is due about 12. So you can wait till about 1 o'clock or 2 a.m. to give another dose of paracetamol, because you had only just given the ibuprofen at 11. So we do teach parents to do that. Space it out. You can give them both together, because paracetamol and ibuprofen are both painkillers, yes, but they belong to 2 different groups of medication. Paracetamol is a pain relief, and ibuprofen is a non-steroidal anti-inflammatory drug. So we all know paracetamol and ibuprofen are painkillers, yes, but they belong to 2 different groups of medications. So you can give them together, but then I do advise personally not to give them together, because if you give them together, then the child is going to have a long time of waiting before being able to have another pain relief, because you've given them together. Then that means you need to wait for another 6 hours until another paracetamol is due. But then if you space it out, then you have the option of giving either paracetamol or ibuprofen again later on. So that's one. Give regular pain relief. Space them out, please. And if your child is allergic to any of this pain relief, please do not give her. And then ensure the child eats as normal. Start with clear fluids or squash like Ribena or Capri-Sun. You can start with that. And then you gradually move on to food. You can give toast. Raw foods are good for tonsillectomy because they need to rub on the surface in order to help the healing process. So you give yogurt. You can give yogurt as well in order to help to soothe. You need yogurt to soothe the back of the throat, to soothe where the tonsils have been removed from, and then gradually go back to the normal diet. And watch out for any fever in your child. But then if you've been given regular paracetamol and ibuprofen, the chances that it's going to reduce fever, as in high temperature, is high, because you've been giving it regularly anyway. because we give paracetamol and ibuprofen to relieve high temperature, which is also called fever. So watch out for any fever, and watch out for swelling around the neck as well. If your child has swelling following tonsillectomy, following removal of tonsils, you need to take him or her back to the hospital. And watch out for bleeding and swelling in the mouth where the tonsils were located, were situated before they took them out. Watch out for any swelling there. And don't expose the child to any form of physical activities or exercise at all, because that can cause bleeding in the child. And what else was I gonna say? Yeah, watch out for bleed. Please watch out for bleeds. If you see any kind of blood coming out from the mouth, please take the child to the doctor ASAP. Any other question? Abidemi, Kafidipe, have I answered your questions? Let me know if there are any more questions before we go. So I have done the presentation. I do it as PowerPoint presentation on the computer, and then I put them into a slide on Instagram. I've done it for our next topic. As soon as I have the chance, maybe today or tomorrow, I will post them on my Instagram for people to read, and then I'll try and get time to, have the live video, and then I'll then think of another topic to treat. So, okay, she says, thank you so much. You're welcome, sis. I really do appreciate you. So that's all to say about tonsils, tonsillitis, and tonsillectomy. Tonsils are the two glands located at the back of our throat. Tonsillitis is the swelling or redness, or the swelling or inflammation of the tonsils, and tonsillectomy is the removal of the tonsils in order to stop recurrent infection of the tonsils. And it's an easy and straightforward procedure. Thank you so much, guys. I think we've come to the end of this live video. I appreciate you guys so much. Thank you. Have a lovely evening and have a nice weekend ahead. Thank you. Bye.